everybody. Thank you so much for joining the Parent Confidence Lab. We are so grateful to have Nora Dennis joining us today. We'll be talking a lot about mental health and especially youth mental health, which I know is a very important topic for so many of us, especially those of us who are raising children and raising young adults. And we're really excited to have Nora with us today. To tell you a bit about Nora, she is a physician leader. She's a board certified in psychiatry and addiction medicine. She has her MSPH in maternal and child health, and she's a pragmatic idealist working to make healthcare more equitable and effective. And she'll be talking to us today about how she founded the Jubilee Healing Farm, which is a clinic and healing farm grounded in the belief that human thriving is possible for all. The tools of medical science, when applied in a context that emphasizes holistic needs such as movement, sunlight, and sleep, changes lives and creates healing that lasts. So very excited to have you here today, Nora. We would just love to kind of first and foremost hear more about you. Tell us a little bit more about your story and how you got into this line of medicine.
Absolutely. So getting into psychiatry was pretty easy because I loved it during medical school and, went through residency and was in a pretty conventional path for a psychiatrist. So I did a lot of medication management. I did ECT. I kind of moved up through the leadership ranks as you do and found myself as the lead medical director for behavioral health at Blue Cross and Blue Shield of North Carolina. And I really got into insurance because I felt like the best way to change our system was to try to change it from payment side. And I found that was very difficult because of the incentives within insurance companies are not to increase access to healthcare, but rather to make it harder to access it in order to save money and reduce what is called the cost of care. And I had come into insurance in this really special moment for mental health care because it was during COVID. And so during COVID, everyone was having mental health problems, and there was a sort of a scramble from a PR perspective and just from a need perspective for insurance companies to expand access to behavioral health care. So I came in, as a public health leader more than anything else and really working to expand access. And then we sort of over succeeded. There was a lot of concern about the cost. And I just started to realize that wasn't the right place for me. And that I also felt like going back to leadership in more traditional healthcare systems also didn't fit for me because a lot of healthcare had become what I call performative healthcare, meaning that technically you're checking all the boxes that you have to check for billing purposes, but that the heart of let me center and heal this human being begins to be lost because there's so much financial pressure to go as quickly as possible. And that doesn't allow depth and complexity that's inherent to humans. So I ended up having a dream, like a nighttime dream about basically healing with earth that sort of I felt actually open and able to receive in the fall of 2022, and then started kind of planning for starting a healing farm. And so that is what I did.
That is so amazing. And Nora, you're not the very first physician that's probably gone into the payer space and seen, all of the different complexities of it. And I'm just curious from your perspective, if you could change one thing about that system, and we'll definitely talk a lot more about your work at Jubilee, but where would you kind of start in terms of aligning incentives in the right way to make sure that we are, as a society, delivering holistic care and not just checking the boxes, as you said?
That is a challenging question. I think that, at one point I was like, okay, I kept being like, I need to be a VP. I need to be a CEO, and what I realized that was anywhere I am along this path and this continuum, our larger kind of capitalist system that requires us to make money off of taking care of people is going to be a challenge. And that doesn't mean we need to have limitless, money available, but it does mean that if we're trying to maximize profit, it's really hard to have another goal simultaneously because maximizing profit is really measurable, and it's sort of a thing that can easily supersede the much more nebulous side of healing, and especially for mental health where we don't have these lovely metrics. I can't, if I'm like, my goal is to improve the blood pressure of this group at a population level, it's really easy for me to have, those incentives for that and me to measure and see if it happened. But if I'm trying to improve depression at scale, we don't have great measures for that. We have, some that we sort of shake out and like toss on the table when pressed, but they're not very good measures of the quality of mental health care and services. And so I think we just can't compete with the profit motive.
Yes, that makes a lot of sense. And I know that's why in other countries it's very different, the incentives and motivations. And tell us more. I'm very curious about this dream and how you brought this dream to life. Can you tell us more about the farm?
Yeah, absolutely. So the farm, we purchased the land in 2023, in April 2023, and then in October of that year, started doing some work on the building that was there to try to make it into a space that would be appropriate for clinical work. At that point, there was a barn that had electricity and nothing else. It was like an empty shell, basically. There was no water, there was no septic, there were like weeds everywhere. And so, the work was to build out the inside of the barn so that it could be a clinical space, and then put in obviously septic, put in water, running water. But then outside too, we had to clear an area for a pasture for our goats. We ended up having to do a ton of kind of like weeding and clearing to put in an orchard for trees, a food forest. We put in a cob structure, like a naturally built structure of earth as an outdoor classroom. And it's just been like year by year by year, trying to kind of add and refine um, in order to just make it as alive of a space as possible, and to support human healing through the way that that space is constructed and designed. And we started seeing patients there on June 24th, I believe, of 2024. So we're going to have a second anniversary celebration on June 26th.
Amazing.
Amazing. What is a typical experience when a patient comes to Jubilee Healing Farm? How do you kind of evaluate where they are and where they will progress, throughout your program?
So our initial evaluations are fairly typical, I would say, like a normal biopsychosocial type of an evaluation. A fairly typical biopsychosocial evaluation. And we do ask folks about exercise and screen time and sleep, which, I think should be a normal part of any evaluation, mental health evaluation. But, and we talk to them too about the program and what to expect. And we really need people to understand too that this is group healing, this is collaborative healing. So we talk a little bit about that we see that, we are each other's medicine, that to share and to be witnessed in our fullness is part of the medicine at the program. And so I always want people to be prepared for that, because I think we come from this really individualistic culture. And so trying to help folks be prepared to see that what they are offering and what they are receiving are very much intertwined. And so we actually, like, we really need you to show up, because you're not going to get better if you don't show up, but also everyone else is counting on you to show up in order for the collective to heal together. And that kind of brings in the idea of ecologies. And so, like, there's the ecology of the land, and then there's the ecology of the self and the group as well. And so, trying to really welcome people into the group and the space and the community, but also welcoming them into the concept that they are part of something larger than themselves.
Wow, that truly sounds amazing. And can you tell us a little bit more about kind of your typical patient in terms of the population, the age, and how are you seeing all of these kind of unique forces work together to really promote their healing?
We have two different programs, and one of our programs is in the evening, and that tends to skew more towards older folks, working folks, and we don't have the same sort of age restriction around it that we do around our daytime program. So our daytime program, which I think is the one that's sort of most aligned with you all's work and focus, is for emerging adults. And so that's folks ages 18 to 28 who are coming to us from a variety of different settings, but really needing less than an inpatient visit and more than your typical once a week psychotherapy visit. And it might be that they're getting out of the hospital and sort of stepping down to our level of care. It might also be that they've been in the community and their therapist is really feeling like, I think you need more than I'm going to be able to offer in terms of stabilization. And so we kind of are right there at an intermediate level of care. And the typical client, often folks are struggling with anxiety, they're struggling with depression, struggling with a lot of isolation, and loneliness. We often have folks who have comorbid cannabis use disorder, which is very, very common. And then sometimes we have people who have had a first psychotic break or a first manic episode, or post-traumatic stress disorder. So our program is transdiagnostic. We don't limit on the basis of diagnoses, except for those that were really not designed to address, which is like eating disorders is a good example where it's like, okay, you need a really specialized team to keep people safe. But we've had folks before where they had an eating disorder that was serious, and we said, okay, go like get your eating disorder treated, probably residential, and then come back to us. And so sometimes that happens too.
Love what you said earlier about, the people are the medicine. And it really seems like there's a social bond, a social glue. And you're talking about the ecosystem of the nature and then of humans in general. You know, you've seen a lot, throughout your career, but, when we talk about loneliness or depression, especially with the teenage population, um, what do you think are some of the driving forces behind that? And how do you actually address that from a social cohesion standpoint?
Yeah, there are a lot of forces driving towards what feels like almost a collective experience of depression in many ways. So you mentioned social isolation, and I think there's this paradoxical experience that a lot of people have where they're constantly connected from a sort of what can I read and see perspective, right? But it's not an embodied connection. It's not a tactile connection. It's not a sensory rich connection. And so things become very internalized, very cognitive, and I think people that creates a loneliness, right? Because it's all just like what I read and what I think. And then there are feelings that align with that, but then are those like shared and processed with one another? And
Mm.
often if they're hard, they're not. Like people just kind of block one another or just end things. And so that like really important developing that relational capacity around repair tends to get neglected, which I think is really problematic. Um, I cannot overstate the role of cannabis in mood disorders right now among young people. It's incredibly strong. It's very cheap. It's really easy to use it very, very heavily. And it's quite common for cannabis to cause mood issues, to cause anxiety issues, all sorts of things. And that I think is very under-recognized. And I think worth like thinking about. I think COVID as well. So a lot of the folks we're working with were in either late middle school or high school during the COVID-19 pandemic. And I think there was the interruption of really important pieces of social emotional development around individuation, identity formation and conflict resolution. And so I think that some people bounced back just fine. They didn't have an issue. But for some people, it was something that they have not fully healed from because they didn't get to create friendships when they're 14 that you normally would create that are, long lasting. They didn't get to practice face to face communication in groups of people. There's a persistent social discomfort that can be there in face to face interaction. And then the last piece is screen time. So, if I'll encounter someone who has less than like 8 hours a day of screen time, and that's not a joke, then I mean, that's amazing. I've had people, I think the max was 18, just amounts of screen time that are, and they'll be like, oh, well, I sleep with this screen on or I do this, but it's like, okay, like I've had folks where it's like almost like constant um, exposure to a screen of some kind. And that's a great social experiment that's been happening, for the last decade or so, and it doesn't seem to be going particularly well. Um, again, like, am I able to be fully present in the world at least some of the time, right? And I think what happens is folks get overstimulated and understimulated. So, visually and from a language perspective, they're like really overstimulated, but then they're understimulated in terms of even like long distance vision, in terms of like tactile and sensory things, in terms of smells, in terms of movement, right? Like, and that's really, and it's really problematic because it's so enticing that it's really hard for folks to fully realize the impact that it's having on them. And of course, there's just like some people get depressed too. There's just the old fashioned like genes part of it where, some folks are wired. And I can say I'm wired this way to be depressed sometimes. And so all of it comes together, I think, and has created a perfect storm where there's just a lot of both unhappiness and feeling really trapped and uncertain how to address it, and then having this world where everybody has like a solution for you.
Yeah.
Be it TikTok, be it, and like there's everyone has a solution for what you're supposed to be doing. And like you're supposed to be like doing this exercise, and you're supposed to be like drinking this thing and doing this. And I think for some folks who they get the sense of like either overwhelmed by all these pieces of advice or a sense of like not knowing who to trust.
Makes a lot of sense. And you touched on like a few of the things that you are looking at in the beginning, which is screen time, sleep, and exercise. So what modifications do you make during your program that you think are having like a big impact on those perhaps three things?
Yeah. So we one of the things is our program is a no phone zone.
Mhm.
And for some people that's just like such a relief because it's the first space that they have, time that they've had for 3 hours without using their phone. It is a really big deal for some people to put their phone away for 3 hours. And we've had folks who've really struggled with it, like who've like snuck to the bathroom to use their phone and stuff. So it's
Mm.
like it's um it's a really intense that in itself is a pretty intense experience and intervention for folks. And then we also, when we do a treatment plan, we will have goals around exercise and movement a lot of the time. We have the data that says 150 minutes a week of moderate exercise is a very meaningful intervention for depressive symptoms. In mild moderate depression, it is equivalent to SSRIs for a large proportion of the population. And so, I told our team like anyone with depressive symptoms should be like part of their treatment plan should be exercising 150 minutes a week because it's certainly not going to hurt them.
Mm.
Uh, and there's a high probability that it will be helpful to them. So that's certainly a piece of it. And then we also, when it comes to sleep, there's something called interpersonal and social rhythm therapy, which was developed quite some time ago. And it, sort of like guides folks that there are sort of 5 key activities that need to happen consistently at the same time each day. And these relate to social interaction, meals, and sleep. And so even just sharing like, hey, we have a lot of data that like going to sleep at the same time, getting up at the same time, social interaction at the same time, that this is a really potent mood stabilizing intervention. That's helpful information. So there's a lot of psychoeducation and then tracking with folks and like working to hold accountability too. Because for sleep, there's this really tempting and pervasive reason why people don't sleep, of course, which is their phone, there to offer bright light into their eyes and endless entertainment. Um, and so, yeah, it's really understandable, and we're trying to collaboratively find solutions that are going to be like going to work for that person.
I love how you mentioned that interpersonal and social rhythm component, which, we work with kids, especially even at a very young age. We know that kids need routines and
Yes.
a lot of
Yeah.
conditions, and there's routines, I would guess, really get set foundationally at a very young age. And maybe if a child doesn't have that from an early age, they tend to be, kind of falling off the wheel, right? It's hard to kind of get them set, but it sounds like there's a lot of really substantial evidence that kind of says routines are really good. Sleep, eating, meals.
Yeah. And I will jump in, Hans, and just say that, like, a lot of people who are parents were not raised in households that were rhythmic. And so then it's like just hard for them. They don't know. They don't know how to do that. And then their kids don't know how to do that. They don't know that it's important to do things at the same time each day. And so it becomes very difficult for them to make that happen. And I have a lot of compassion for that, because it's confusing if you yourself grow up in a somewhat chaotic household to offer something different. Like how could you? How would you know?
I wanted to go back to one thing you said, is that we're simultaneously overstimulated and understimulated at the same time. But in context of, the phone that we have in the palm of our hands, we're very connected digitally, and you can like and message and everything else, with your friends and family. But there's a difference with the tactile and the sensory type of connections. And I'm sure a lot of the connections that you do at Jubilee, but what's the science behind that? What's cognitively happening? What's the psychology behind those different forms of connection where, it's not as enriching as the things that you guys are doing?
Yeah, it's so interesting because I was just like reading a book, I think it's called Attachment Psychotherapy by David Wallen. It's an old book, but I was kind of brushing up on my attachment theory and attachment psychotherapy, and remembering mirror neurons, which are one of our most important sort of social functions as a human being, and social, sort of our social biology, where we from they have even like had data going back to 42 minutes after birth, where they have a newborn baby, and someone sticks their tongue out at the baby, and the baby sticks their tongue back out, right? So we're designed, and you don't get that through a screen in the same way, right? I don't mirror through a screen the same way that I mirror interpersonally. We can fall out of practice with mirroring and connection, and it should be unconscious for us, right? That we're that we're just looking at other people when we're interacting, and like they smile and we smile, and they express shock, and we're like also raising our eyebrows and expressing shock. And this is like one of the sort of fundamental aspects of the neurobiology of connection, is mirroring. And we know sort of this is a little bit of a different piece, but we look at folks who have depression, and there's a lot of what we call negative filtering. So negative filtering is when I'm in a situation and it's actually like, okay, it's not horrible, but I filter out all of the things that are actually good about it. So all I see is the negative, right? And so if I'm unchallenged in that, I'm isolating, I'm unchallenged in that perception, directly or indirectly, right? Because even just being alongside somebody else who's perceiving something different, if they're not directly, even they're not like, "Hey, I think it's great," they're indirectly offering their different perspective that challenges my way of thinking, of seeing the world. The environment shifts, that might challenge my way of thinking, my way of seeing the world. And so I could text you like, "Feel better," but there's that's not the same as having like the mirror neuron experience, and like the social experience of different space, and the full body presence, that and the impact that that's going to have on my mood, and but also that sort of feedback loop between the body and sensation and physical perception and cognition, right? Because that information is always moving back and forth between the different parts of our brain, and then creating the overall sort of messaging, thoughts, emotions that we're moving through from day to day.
Wow, that's all so interesting. And I can definitely relate to the, I forgot what you called it, um,
Negative filtering.
that negative filtering, especially with my house. Like when I'll like look at the room and it's like all I see is the mess, or all I see is the things I don't like about the whatever room, and I have to remind myself, oh, like you like that part of the room, you like this, you like that. But being a parent with little kids, it's like just everything always feels like a mess. I think
Or someone comes to visit, right? And they're like, "Oh my God, your place is so cool. I love it." And you're like, "This mess of a place," and it's like, no, like it's great. It's really cool. It's alive and it's kinetic because
yeah.
people live here, and they're always putting their stuff somewhere. So,
Nora, I'm going to thank you right now because you're giving a name to something that we've experienced a lot in the household as well. Because I'm always the positive filter.
Yeah. Hans
And
doesn't
sometimes,
notice mess ever.
yeah, I'm like, it's not messy.
Yeah, you have clutter blindness.
Little clutter blindness. Or my dad calls it eye pollution. Bella, eye pollution. So yeah, I can definitely relate to that. Now I imagine that a lot of folks listening may have, children who are maybe struggling with depression or maybe are kind of isolating on their phones all the time, whatever it might be, teenagers or early 20 somethings. What advice do you have for them? Like, I know not everybody can come to your farm. Advice do you have for them, maybe for their own children? And I think a lot of this is for us too as adults, right? We're all experiencing these same sort of addictions.
Yeah, it's funny. I also have a teenager who's on his phone. So, and I also share the struggle of like what is too much interference and control versus like the right amount, and what are the right guardrails around like parental controls and downtime and all this kind of stuff, and like gradually removing those. I mean, it's really, really tough. And when I was in residency, I had several really lovely psychotherapy. They don't train people in psychotherapy the same way that they used to when I was in residency. So we'd have to be doing couples or family therapy in this room where one wall is a giant one-way mirror, and a group of our colleagues was watching us do it. And like and there was also a sort of a senior therapist watching us, and they would call in on this phone and tell us to do something different if they didn't like what we were doing. It was like literally like a landline stuck to the wall. But I had one of my amazing, I think his name was Michael, one of the sort of leading elders therapists who was supporting us, talked about how with teenagers it remains just as important to create meaningful connection with them, and that doing a project together where you don't have to talk is in sort of a parallel play type of project or activity. So his example was repairing a VW bus with his son because he was kind of older. But it could be like fishing, right? Like where two people are fishing, they don't really have to talk to fish, but like it's still interesting and rewarding to fish together. I'm hoping with my 16-year-old we paddleboarded a lot together last summer, where it was just like, okay, look, I don't have to do anything to paddleboard. You can't really use your phone when you're paddleboarding because it'll fall in the water and get ruined, and so that's like maybe a good thing to do. I do realize that that's an expensive activity. So I think fishing is a nice example too, because it's maybe a little bit more accessible. Or here in North Carolina, that's a pretty accessible thing. There's lots of bodies of water, and a fishing license is like, $15. But just finding that thing. I know someone who skateboards with their kid, which I think is kind of cool. Definitely not something that I'm physically up for, but basketball, just all kinds of stuff where there's like, again, creating that. There are lots of different ways to connect, and connecting with words is one way, but a lot of times at this age, there might be a tendency for things to end in conflict. So are there things that we can do together that are nonverbal? And where there's sort of a shared goal, whether or not it's articulated.
Love that.
I wanted to go back to the negative filtering topic that you're saying, because it's so fascinating, because I was looking at Christina, but we definitely have people in our lives, and I'm sure everyone has people in lives that have that negative Nancy almost kind of moniker almost, and they're seeing things on one side. But one of some of the things that we've learned, I've learned individually throughout my life is really the importance of gratitude. Gratitude can sometimes really be that filter where, and sorry, this is my simpleton way of explaining it, but that the prefrontal cortex is really wired to think about everything that can go wrong. Talking about back in the caveman days, like the saber-toothed tiger that's coming out of the bushes or whatever else it is. But a lot of times the things that go right, or the things that we're very grateful for, appreciative of, sometimes reside in the back of our minds, not necessarily the prefrontal cortex. And so I'm wondering, first of all, is that true? and second of all, is gratitude a practice that you guys, are preaching in your on your farm?
Yes. So So yes, I think we are designed to sort of have that anxiety and to see potential danger, basically of danger awareness, and that is a good thing because wandering around like a sort of duckling with no awareness of what could go wrong would be probably end poorly for most of us pretty early on. And we have actually a curriculum where we have each week we have a different theme that we focus on. We have sort of a 12 or 13-week cycle that we go through. And one of the weeks is gratitude. And when I first introduced gratitude, we got a lot of pushback from staff who said, people have been socialized to feel shame around their distress by like being weaponized gratitude, basically. And I really tried to explain to them like what I mean by gratitude. I don't mean a gratitude journal. I don't mean a gratitude list. I mean shifting my vision and way of looking at the world to one of wonder and awe. Because if I actually am allowing myself to fully take in what is around me, I cannot stop feeling a sense of wonder. And it is a spiritual space and a spiritual practice. But there is a reason that so many indigenous spiritualities start from a place of gratitude. And thank you for creation, and thank you for the sun, and thank you for the bugs, and thank you for all of these things. And so, during Gratitude Week, we have an ecotherapy practice that we do, where we come together, and each person gets like a different creature, basically, or family of creatures that they are assigned to create like a little writing about what is wonderful about that creature, that group of beings. And then we go around and each person is sharing their sort of ode and it's sort of like this gratitude connection as celebration, as ceremony. And it's a really beautiful practice. It's actually based on a paper, I believe, from the Journal of Sustainability Studies by a woman named Paulette Moore. Um, and yeah, it's a really inspiring practice for folks. And so, if I'm assigned the trees, let's say, then I would say, and now I give thanks for the trees that are so high above us, that offer us all the wood that we use to make many different things in our lives, whose roots remind us of all that we come from and all the ways that we can grow from deep connection, whose leaves shade us, and we give thanks together for the trees. And so then, someone else will go on and they've got like the rain and, each person has something and, a lot of folks had the experience, and I hadn't really had the experience before coming into the program and leading the stuff of like, let me gather in circle with a group of other people and consciously honor and love all of the abundance of the earth that I have the great benefit of living from every day. And so it's a little bit different from the gratitude jar or list or something like that. And I think it's important to practice gratitude in this way because, again, it's not something that I'm doing alone. And if I have sort of ritual or ceremony around it, then I have a container and space to honor the gratitude that is within me with other people.
I love that. I love that so much. I remember even just growing up, my dad, every night at dinner, he would say, okay, everybody say something they're thankful for. And it would become like this race to say, like, I don't know, I always wanted to be thankful for the food. But like my brother would say it and I'd be like, no. And I'd be like, I'm thankful for the drinks. But I love the idea of incorporating the like thanking nature. I love that. And in one of our books we were just reading for our book club was a lot about talking about Zen and Buddhism, and they were saying that it was a female Zen master, and she was saying like she would like thank the toilet before she went to the toilet. And I like always think now before I go to the restroom, like, I should thank you, toilet.
Yeah, well, if you've had a lot of camping experiences, it's like incredibly relaxing to be able to go to the bathroom inside.
Exactly. I really love that.
Septic tank.
Yeah, I mean, it seems like obviously we haven't really talked too much about it, but a big part about your program is being in nature. So can you talk to me more about that? And then again, for the parent listening who might be struggling with their own mental health or their teenager's mental health, like how can they incorporate nature into some of the healing?
Yeah, I mean it's really at the heart of everything that we do. And we spend time outside every day. The only exception is that it's like, 38 degrees in like pouring rain, like we probably wouldn't spend much time outside. But we have like a bunch of ponchos. Like we'll go out in all kinds of different weather. We built this outdoor classroom so we can be outside in the rain as well. But I think that a lot of our work that we do is about trying to give people context for themselves, and that we find ourselves often out of context. And like, I think that's one of the downsides about the phone, right? Or the social media and so forth. It's like, I get jerked from one context to another context to like this thing I should have, this thing I should be. And it has nothing to do with my family, my people, my land, my history. It's contextless. It's this contextless self-definition, and it creates tremendous existential insecurity for a lot of people, I do believe. And so nature is our context. Like that's the original context. This is the land that we're living from. This is the air that we're breathing together. This is the water that we're drinking together. That is my context. And so we have to then learn how to be in context. Like it's not something that we necessarily know how to do if we haven't been able to practice it. And so, we do forest bathing as well in the program, and it's one of the participants' favorite things. We have these hammocks, and we'll take them out in the woods and show people how to set them up, and then they relax in the woods and look at the canopy, because I think it's really important to look up, and then just laterally. So we'll have them look up at the forest canopy and relax. And I had an experience relatively recently where I was doing a peer support specialist training program that incorporated ecotherapy and other elements. And there was a lady, she's like, I don't know if I'm going to like this. I don't know about this. And she like just fell asleep, in the forest. And it was just like so beautiful, right? Because it's like you're meant to be there. You're meant to be there. You did not, we didn't have hundreds of thousands of years of human evolution to like be inside on a computer. This is a very recent invention and way of connecting with other people. And I am dwelling in a context where it's necessary and required for me. Like I definitely can't function without a computer, but I think we also have to have intentional remembrance of our original context. And for little kids, man, like they just shine when they go outside. In the same training, one of the trainers had to bring their little one, and they had a tablet for them, of course, because you're inside and you're having to do a training all day, and like, what are you going to do? You got to bring your kid with you. This like a tablet is this thing. And I was like, okay, well, I can take him for a little bit outside here on the farm, and we'll do some stuff, and that way like he gets a little break. And he just came alive. Like I was like, oh, do you want to feed the goats? And we had some like brassica that was kind of going bad. And he like grabbed it and he ran to the goat. I was like chasing this little guy because he was moved before. Ran to the goats. He ran back to the brassica. He came fully alive. And I think it's hard with teenagers, right? Because they get into this like sort of schlumpy, like bedrock kind of a thing, and you almost have to kind of like pry them out with a crowbar. But I think that they come alive too when they get outside. A lot of times, right? Someone who's really, really depressed, substance use issues, whatever, like the like problem that causes is that they're disconnected. They're disconnected from the earth. They're disconnected from themselves. They're disconnected from their community. They're going to feel bad. Yeah. And so, if you are in connection with community and earth, and that person can't seem to find a way to be there, like that's a sign that, you're going to need more support and more help. And it's going to be more than medicines. I think that's the thing that's hard as a psychiatrist, is that we have, and I'm not against psychopharmacology. Like that is what I was trained to do. I prescribe medicines every single week. Like but it's not enough for a lot of people. It's not enough. And trying to offer a more holistic solution or more holistic care for people is, I think, really, really important.
We are social animals, and we do need that connection, and it's really important each and every day. I've learned 2 new phrases from you: forest bathing, which is amazing. We have a tree house in our backyard, and sometimes I actually sleep through the night in the treehouse, and it actually gives me better sleep because I measure my sleep with my Aura ring. I can tell it actually gives me better sleep in general. I don't know if it's the air, if it's the outdoors, or whatever it is. But then you also mentioned the indigenous spirituality. Most indigenous spiritual practices kind of are based on the earth and being thankful for the land and the natural environment. That's something I've never really thought about, but then, thinking about it is, it's really, that's really common across all, it seems that.
And again, and ours. I mean, I think Judeo-Christian, if we kind of go back to the roots of it, also, right? Like it starts with gratitude for everything, the abundances that are around you. But I think that we kind of get disconnected from that because we don't feel what it feels like to not have it, and so we forget, as as people do, right? There's nothing wrong with the fact that we forget. That's how people are designed, for better or for worse. But then we have to have like conscious practices of remembering.
That conscious practices of remembering. So much wisdom today. Thank you so much for joining us on Juneteenth, taking this time, joining us during the World Cup. We so appreciate it. And we like to always close with, you are a mom, you are a doctor, you are in this wonderful space of healing. What advice would you have for kind of your younger self when you look back when you first became a mom?
Oh man, it would just be to play more.
Ooh.
That's my advice for myself now. It's like, actually, I'm going to say one more thing. It's like we do a bunch of different week themes. And one of our themes is expanding capacity. And a lot of times in mental health, we'll talk about like, the window of tolerance. And there's a woman, I'm remembering her name really quickly because I want to make sure to give credit where credit's due. So her name is Dr. Kathy Malchiotti, and she came up with this idea of the circle of capacity rather than like window of tolerance. So window of tolerance is like, let's try to open it a little more so you can like put up with bad things, and or aversive things, right? And what we are seeing with the circle of capacity is like, oh, we're trying to actually open ourselves up towards all kinds of experiences. Because a lot of people who are depressed or in a trauma state, they actually can't tolerate laughing. They can't tolerate fun. They can't tolerate joy. They can't tolerate curiosity. And so in the expanding capacity week, we're like, oh, let's hula hoop. Like, let's let's like do silly things and fun things. And I think like I started my medical education young, as people do, and went through, from age 25 to age 35, basically just like not having fun very much. So I wish that I had more fun. And I'm still working on that, trying to increase the amount of fun that I have in a given day, which is why it's really lucky to be a parent, because kids are sort of inherently really respond well to play and fun.
So what are you personally doing to increase fun?
Well, I've been dancing more, which is, I think, like I love to dance, and I sometimes I'll forget about that, and then remembering dancing more, and then also playing with the dogs. I think that's a really important way of having fun, because a lot of times, like as a parent, you're like, oh my gosh, why do I have a dog? This is so annoying. Like they wanted the dogs and they play with the dogs, but then I'm like walking the dog and picking up the poop. So trying to play with the dogs more as a piece of it, and also just play games with the kids too. So lots of fun.
I love that. I actually decided that 2026 was going to be my year of fun.
Nice.
Like for the same reason, I feel like we just kind of forget to incorporate fun, and that was such a good reminder for me. So thank you, even with my little ones, to play more, because it's like my sister
Yeah.
comes over and she plays with them, and I'm like cooking dinner,
Yeah.
laundry, putting away the dishes, and it's like, when do I actually play with them? So I love.
Yeah, it's hard. You might have to order food and crap food, order cheap food.
There you go.
Being more okay with that is also something I've been working on. Like, oh, it's actually like, let me just have a non-complicated, here, have some carrots and yogurt for dinner.
Thank you. That is so true. Like when he goes away from work, I'm like, I tell myself before he leaves, like, it's okay to just order in. It's okay to do simple meals. But then I still put that pressure to have the perfectly balanced dinner every night, homemade. So thank you. I appreciate it.
Yeah. I'm a kid of the 80s. And my parents were like, have some fish sticks.
Oh, yeah. We had steak on this.
The TV dinners. Yes. TV dinners.
Totally.
There's one for you, right? Eat food. Don't talk to anyone. Just watch the TV. You're good, right?
Seriously. See how that goes.
Well, thank you so much, Nora. It's been a real pleasure. It's really been a learning experience for me as well. And so thank you for sharing your knowledge, your wisdom, not only with us, but with everyone listening at home or wherever you are. So thank you so much.
Well, thank you for a fun conversation. I appreciate it.
So appreciate it. And if folks want to find your farm or want to learn from what you're learning on the farm, I know not everybody's in North Carolina. How do they find you?
So they can Google Jubilee Healing Farm or Jubilee Clinic. Both of those will bring us up.
Thank you so much. Have a wonderful rest of your day. And thank you, everyone, for joining us.
Bye-bye.